Welcome to PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso. In today's episode, we'll be talking about global health. Cham, what is global health?
Well, global health is just dealing with the healthcare problems around the world. We really have the same problems worldwide. America really is only 5% of the world, and in some cases, we can help other countries with some of our expertise, and like here at the faculty at the Center for Global Health. And in some cases, we have a lot to learn from them.
And University of Georgia ranks 10th among the leading universities for our study abroad program. So we have a lot of our undergraduate and graduate students who are traveling all the time. So global health becomes a really important issue as diseases and the health that goes along with those diseases crosses our borders.
Well, we really saw that with the pandemic flu scare. I say scare because we kind of dodged the bullet, like we talked about in a previous episode here. Really shows us the importance of global health. It's likely to be a pandemic flu reality next time, and global health research is really the best way to deal with that.
Well, today we're going to go around the world as Cham interviews some of our leading experts here in the Center for Global Health, and we'll also be interviewing some faculty abroad in Germany. So stay with us.
Now we're going to look closely here at the Center for Global Health, and we have two guests here today from the center. Dr. Richard Schuster, who's the director of the center and professor in the Department of Health Policy Management, and Colleen O'Brien, who's a researcher in the Center for Global Health. Well, Richard, what is the Center for Global Health's mission?
Well, first of all, Cham, thanks so much for inviting us. We're really delighted to be here, and we're here together because global health is a lot of work. It's a big, big field, and it's very important that we understand global health. The mission of the Center for Global Health here at UGA is, first of all, to understand best practices of healthcare anywhere in the world, because healthcare is not necessarily just the best here. So we want to find those best practices, and then we want to disseminate them. We want to let everyone know what is the best practice for a particular area. Then it's important for us to promote their adaption and their adoption. So let me explain that for a second. Adaption is really essentially a cultural phenomenon, and Colleen's going to talk about that a little later. Because just because a best practice works in one place in the world doesn't mean you can just walk it across and use it someplace else. And then adoption is really critical. That's disseminating and implementing a practice, getting people to actually use it. And so we're about the mission of doing all of those things, to identify those best practices and get them used anywhere in the world.
Well, Phaedra and I talked in the introduction about how University of Georgia is ranked 10th in the country for students going abroad. Tell me, why does the University of Georgia need a Center for Global Health?
Well, the center was formed about a year and a half ago, and it was really created because there's a tremendous interest and really a need in global health as well, both from a research perspective. We've got a lot of research going on in global health. We're going to hear more about that today, and also tremendous interest on the part of students.
Well, we're here in the College of Public Health. Tell me, what's the difference in the connect between public health and global health?
Okay, so this is a little complicated, but let's try to play it out if we can. What we're now saying is that global health is public health, and public health is global health. And the point with that, Cham, is that any way you look at it, healthcare anywhere in the world is more the same than it is different. And the way to look at healthcare is to look at it through the eyes of public health, where we're looking at prevention, we're looking at populations of people. That's what public health is all about, and it's got to be looked at globally.
Okay, I've got it. Public health is global health, and we'll come back in a minute and we'll talk to Colleen about what's going on in the center and around the world. Come back and join us. Well, we're back with the Center for Global Health, and I'd like to come back to you, Dr. O'Brien, and talk about the specific programs and research here in the center. And to start off, I'd like to talk about how culture and health are related here.
Well, Cham, I'm a cultural anthropologist, and so what I'm really interested in looking at are these interactions between culture and health. And actually, culture affects health as much as our genes do. So our beliefs about disease, the way that we talk about them, and the institutions that we have to help manage those are all really important when we're looking at aspects of health.
Well, how does increasing our cultural understanding of diverse populations help us in coming up with solutions for public health?
Well, one of the examples I could use is with language. So if we understand someone's culture and the way that they speak about health, and we're using a common language, that's really going to help with our preventative and treatment programs and make them a lot more successful.
Well, describe some of the Center for Global Health's current research initiatives and programs.
Well, we have several research programs going on right now. One of them that we're looking at is the difference between U.S. and French physicians and how they treat cardiovascular disease. And what we found is really interesting is that French physicians have a different way of interacting with patients. They spend more time with them. They also talk a lot more about social aspects of the patient's life and daily habits. What we're finding is that they're having a lot more success in treating these types of chronic disease. So our next step that we're proposing right now is to go conduct research in France, where we'll be actually doing observational research in the physician clinical offices, watching these interactions that French doctors have with their patients.
Well, this is a very interdisciplinary field, obviously, global health. How do you plan to involve these other schools in what you're doing here?
One of the things that we're doing right now at the center is that we're building a database where we're going to be able to have listed all the research that's going on that has to do with health all across campus. And what this will do is it'll allow other researchers to talk with one another, to collaborate on grants and projects so that we have a lot more overlap. We have a lot of researchers on campus doing health and cultural-based global research, but they're not always talking and knowing what each other is doing. So this will really facilitate that process.
Okay, well, thank you, Dr. Bryan. I'll come back to you now, Dr. Schuster. What are the current, in educational programs, what are the current and planned coursework available in the Center for Global Health?
Well, we already have some courses for undergraduates in global health. I think the big news is that we're just starting now a graduate certificate program in global health.
Well, what are the requirements when a student wants to come in here, a graduate student wants a global health certificate? What are they doing?
Okay, first of all, it's 18 credits. It's going to involve a series of courses to take. One of the hallmarks of this is going to be an internship in global health. Most of our students will go overseas, take an elective or two. One of the really important things is that even though this is going to be largely of interest to public health students, it's also geared for students throughout the university because global health is so important and of such interest for students, whether they're in business or communication, journalism, international affairs.
They're going to come in, I'm
Yep.
sure of that.
Yep.
So there has been a lot of interest,
Oh,
both
absolutely.
graduate and undergraduate?
Yeah, we anticipate very quickly filling our certificate program at the graduate level. At the undergraduate level, we have a couple courses, and our future goal is to create either a minor in global health or a major in global health. That's in the planning stage.
Well, you two are going to be busy. I can see that. Where is the center currently working now around the world? And what international partnerships are formed now and going to be formed?
We are right now at about 13 different places around the world. And I anticipate when we look at this again in a year, we're going to be at many more places than that. And actually, Cham, we're going to look at some of those places today.
Yeah, sounds great. Stay with us.